for hip extension, we're gonna do the Thomas test to assess passive mobility of that hip. So you gotta go up on some sort of table or some sort of blocks, just so your leg doesn't hit the ground when you're performing this test. And you're gonna scoot your hips all the way to the end. You're gonna grab the other leg. I'm gonna be assessing my right leg right now. So tuck the left leg up close to you, and then keep the leg straight as you let it drop down. So hugging this knee prevents the lumbar extension from occurring. So then you can really assess that true hip extension. And now if I can get past horizontal down, then I have adequate hip extension. So that means that my hip flexors are not tight, even though they might feel tight, but they're not actually tight. And yeah, so that is how you passively assess for hip extension. So I have probably a little bit more than 0 degrees right here. And so how you assess for active mobility of the hip extension is you're gonna be in quadruped. So you're gonna be in the same position, this leg is tucked in, and you're going to lift. So I can probably barely get my leg up, which means that this is something that I should work on controlling and improving. And this is the actual same drill that I would give people to begin improving this. And if they can't do it in kneeling, if they have knee pain and stuff, then I have them lay over like blocks. And begin working on hip extension this way, but then it's a little bit easier to kind of begin to extend your lumbar spine. I have them dig up into the block with their left leg and then extend the right. And then you can add ankle weights and make that a little bit more challenging.